What is the actual reason following it? Can you tell? Right? There should be any problem with our body, right? In cells or in organs, right? Or we could get infected by organisms, right? That's why we follow it. So in this chapter, we are going to learn about our health, then how we are getting the diseases, and then how to prevent all those things. Okay. So, what is health? Health.
Health is like kind of like an immunity
Hello,
to
ma'am.
diseases and
Good evening,
infections.
Hello.
ma'am.
Good evening. Yes. Tell me.
And man, health is kind of like your immunity towards diseases and illnesses and fighting them.
Yes. Health. It's like complete. If someone is healthy, that means they are physically, mentally, and socially they are fit. Physically means they don't have any diseases. Okay. And mentally means the mentally they are not having any stresses, or they are not depressed. All that comes under that. Then social well-being, their surrounding where they are living, and their community, right? They have good relationship, so that person is healthy. Okay. That is that is the meaning of health. Okay. Now, before that, you have to see this: healthy and disease free. There is a difference. Healthy means physically, mentally, and social. Socially, the person is healthy. Okay, that means well. Okay, they are fit. And in disease free, what is that? They don't have any disease. They don't have any discomfort. Okay, or their organ is perfectly fine. Okay, everything is fine in their body. That is disease free. And this healthy, it will this healthy we use this healthy persons or individuals, whatever we use it in, we can use that term for the individual as well as the community. Okay. And this disease free, it only it is only related to the individual. And healthy person, they will always be disease free. A healthy person is always disease free, but not in the case of this disease free person. They can be healthy or unhealthy. Okay. And if healthy person, they are energetic, and they are able to perform all this function. Okay, all the things which they have to carry on, all the work. And disease free person, they depend on the environment. If the environment is good, I mean, if the surrounding, the people, they are supportive, then the person will be able to, depending on that environment, they are going to perform. Okay, this disease free persons. Understood between these two? Now, see, there are factors affecting the individual health. Okay, first it is social environment. Then what is that? The place we live in, that is our social environment. And there is like public cleanliness. Oh, what is that? The surroundings, right? They should be in hygiene condition. Everything should be hygiene, neat and clean. Then also the person should have the income, jobs, okay, opportunities. And the social, this equality, they should get equal respect. And the relationships between the individual and the community or other members is good. They are in harmony. That means these all are the factors which affect the individual's health. Okay. One. 5F for cleanliness, for hygiene condition. Okay. What are the 5Fs? First is fluid. The fluid substance, all the liquidy form of water, all this liquids should be stored, yeah, and should be treated before drinking purpose. Have to check the drinking water. Next, finger, after coming from outside, and after coming from the bathroom. Okay, you have to wash hands. And next, the flies, right? This flies, they step on the food. Okay, they eat food, so this flies, they spread diseases. So this flies should be also be controlled. And the vegetable, right, before cooking they should be washed. Okay. And next, drainage system. This sewage, it should be treated. After that only it should be used for other purpose. This is the fecal matter. Okay, this too. So the hygiene can be maintained, the prevention, these are all the steps we can do. Okay, it's given in your NCERT book. Next, disease. What is disease? It is a condition, right, which disturbs the normal function of our body. Okay, so in our body, many organs are present. If sometimes stomach could be damaged or kidney could be damaged, so all this thing condition will lead to disease if it is not functioning properly. One thing more is this. First thing is symptoms, signs and symptoms. If someone has malaria, what will happen? They will get headache, they will get fatigue, right? They will be tired, or they will be having
Ma'am,
nausea, like
isn't
they will
fatigue
be.
and nausea the same thing?
No, nausea is type of like they feel like vomiting.
Ma'am,
Okay,
then why nausea and
sometimes.
vomiting are the same thing, right? Like
No,
dizziness, nausea.
vomiting means you're vomiting. Okay, nausea, you're feeling like it. Okay,
Yes, ma'am.
that is the difference. Okay, this fatigue, it means tiredness. Okay, then chills and fever, all these things, these all things are symptoms. Okay, these are the symptoms. This is felt by the individual who are having a particular disease. Okay, now this then the signs, right? After that, what will happen when you go to a doctor? What will check? Take blood test or urine test. After that, he will find out, right, what content. Okay, if he's taking the blood test, he'll find that the plasmodium is present. Okay, so he will tell that this person is having what? Malaria. Okay, this person is having malaria, and then according to that, the medicine will be given. Okay, so the signs, they are observed by persons. Okay, like doctors, and it is observed by the persons by machines. Okay, like in the COVID and all, they have the to check content. Okay, the blood content and the urine content, all that stuff. Okay, that is sign. And symptoms is felt by the particular individual. That is the difference. Okay, now we have two types of diseases. Okay, acute and chronic. Acute means the person, the disease, right, the disease, it will last for only short amount of time. Okay, only short duration of time. After that it will be over. Like we have cold, right? After that it will get over, right, after a week or so. And in chronic, what will happen here in chronic diseases? We have in this condition, what will happen is the disease, right, it will last for long period of time. And because of that, right, organs and all will get infected, will be affected. And most of the time, right, it will be fatal. This is the thing. Now, causes of diseases, there could be immediate cause or the contributory cause. Immediate means, yes, immediate cause.
Am I like something that ma'am, like something that can immediately cause a problem? Like it doesn't take time?
Yes, here it means that it is the cause of, it is the primary cause of that disease. Suppose this malaria, right, how it is caused? When mosquito bites, right? Mosquitoes bite has in its saliva, what does it have? It has the plasmodium protozoa. Okay, now this plasmodium protozoa, it is the immediate cause. Okay, it is the immediate cause. that microorganism is the immediate cause. Okay, not the mosquito. It is only the means of spread. This mosquito is a vector. It is the means of spread. But the cause, the immediate cause is what? That particular microorganism. Understood, Advika? Understood. So it could be bacteria, virus, fungi, or protozoa. Okay. This disease is caused by the bacteria, right? It is called bacterial diseases. Okay. And this one, next is the contributory causes, right? It could be internal causes. This immediate causes, you can call it as what?
Ma'am, I have a question, ma'am. So, in for immediate causes, it says they're real or primary causes. So, like, what does it mean by real?
Real, it is the real cause. That's what I'm telling. It is the real cause, the microorganism, not the mosquito. Understood? It is the real cause. That microorganism is the cause. That is the meaning of immediate cause. Immediate cause means real cause. First thing, that means primary. Okay. Now this immediate cause, right? It could be also, we can also call it as external causes or extrinsic cause. Okay. Now, contributory causes, right? They are called intrinsic or internal. Okay. See, in this case, what happens here is they are not the causes. Okay. They do not lead to diseases, but they contribute in the cause of disease. Like if the place is polluted, if the water is contaminated, right? Then cholera will happen. Okay, so that unhealthy condition, right, that is our contributory causes. Okay, improper public health facilities or poverty, those are the contributory causes. And next, disease could also happen due to the poor health, right? The person is not having that balanced diet, right? All the mineral is inside their body, nutrition, the vitamins, okay? Because of that deficiency of vitamins, disease will occur. Next, genetic disorder. That means they are what? When they are born itself, it is there. Those are genetic disorders. And because of the what? Public facilities also, it will cause diseases. These are all the causes. And I have talked about the bacterial diseases, right? Caused by bacteria. For virus, if it is caused by virus, then it will be called as viral diseases. Okay. And if disease is the causing microorganism is what? Protozoa, then that disease will be called as protozoan diseases. Okay. And if it is caused by fungus, then it is fungal diseases. And sometimes insect could also cause diseases, or worms could also cause diseases. Okay. Can you name some bacterial diseases?
Fever.
That common cold, it is viral.
Ma'am, what about fever?
No, fever, it is symptoms. Okay.
Right.
In many condition, fever will occur. You won't be able to find what is the
Ma'am, like
cause.
tapeworms
Only
and
if you
all.
are taking the test. The, what?
Ma'am, can you say tapeworms because they are bacteria, right?
No, tapeworms, they are not bacteria. They will come under the worms category, right? Peptic ulcer. Okay. Some cases is acne, right? Acne will be caused by bacteria in some cases. Okay. Not only puberty, also will puberty, during puberty also we there will be acne, but other causes could also, one of the causes could be also bacteria. Okay. Then for virus we have common cold, then AIDS, then can you tell example? Now, what was the
No,
in
examples of what?
2020 of viral diseases?
Ma'am, coronavirus.
Yes, COVID. Then protozoa diseases, malaria,
Ma'am, dengue.
dengue virus.
Alright. Ma'am, but isn't it from a mosquito?
Yes, mosquito. It is vector. It has that virus inside it. Okay,
Ma'am, then how is malaria protozoa diseases?
because the mosquito, it will have the protozoa.
Right. Okay, yes, ma'am.
Okay,
Thank you. Yes, ma'am.
that is the difference. Different mosquitoes.
Yes, ma'am.
The mosquito which carry malaria, the protozoa, it will cause malaria. The mosquito which carry virus, that is dengue. Okay, and then here mumps, all that other stuff. Then fungus, for fungus, ringworm, right? This is the name of disease. Okay, here the person will have this round shaped skin disease. Okay, patches. And athlete foot, that is also fungus disease. And in the worm cases, the roundworm, elephantiasis, that one. Okay, so all are this. Next, the infectious and non-infectious diseases. Infectious diseases means what is that?
Ma'am, infectious diseases.
Right,
Ma'am, like,
infectious diseases.
ma'am, diseases that can like be passed on from one person to another.
Yes, that is infectious diseases like coronavirus. It is passed from one person to another. Those diseases which are passed from one person to another, those are called infectious diseases. And non-infectious diseases, that is it is not passed from one person to another, like diabetes, right? If you shake hand with the person who is having diabetes, it will not spread, right? That is not communicable disease.
Ma'am, even cancer, right?
Even cancer. Now, example of this I have already told, right? Diseases, example of some diseases here it is given. For virus, common cold, influenza, dengue fever, AIDS. And for bacteria we have typhoid, cholera, tuberculosis, anthrax. Okay, next, for skin diseases, right? Fungi causes different kind of skin diseases. And malaria and kala azar, protozoan diseases. This lymphitis diseases, have you seen that figure? Sorry, this abnormal growth of the legs you will see in some people, that is caused by worm, roundworm, elephantiasis. Okay. What are antibiotics? Right, it is a substance which is given. This is the medicine. Okay, which is given to kill the bacteria. If you are having any bacterial diseases, then you can give antibiotic. Now let's talk about now. First antibiotic discovered was penicillin. How does penicillin work? Okay, what happens is bacteria will be having what? Cell wall. This penicillin, what it will do, it will break cell wall. Okay, because of that, that bacteria will die. After that, it won't affect. Okay, so what is needed here is, whenever you have any problem or anything, you have to go and see doctor, because you have to know the signs, right? You have to get tested, then you will know which kind of disease you have. After that, antibiotic could be given, the medicine, particular medicine could be given for that particular disease. Okay, now here we are talking about this peptic ulcer. Okay, because of this many years ago, peptic ulcer, they thought that because in peptic ulcer what happens is,
Excuse
we
me,
have
ma'am.
the stomach, what?
Ma'am, I was asking that elephantiasis, ma'am, it's also caused by mosquitoes, no?
Spread.
Yes, ma'am, it also spreads by mosquitoes. Also.
Spread, not cause is different. Okay, spread.
Yes, ma'am.
Now here we have this peptic ulcer. Okay, here in peptic ulcer, what happens here is the stomach, right? The stomach part, right? It will get affected here. Okay, patches will happen because of that. In urine, blood will come and all that stuff will happen. So because it will damage the stomach. Okay, and because of that, acidity problem will also happen. And what was thought at the time was that this disease is caused by the lifestyle of people. So if we eat particular food, it will not happen. So these both scientists, right, Robin Warren and Barry Marshall, this Warren, um, um, this Barrel was the student of this Robin. Okay, they both what they thought was they both separated the stomach and saw which organism is affecting. They saw that this bacterium Helicobacter pylori. This was the cause. Okay, they found out that, and because of that, they also got the Nobel Prize. Because they found the bacteria. After that, antibiotic was developed. Then people were getting cured. Right. Before that, it was chronic disease. Now it became acute disease. Okay. Now means of spread. Okay, so it could be the disease could be spread by from infected person to healthy person by air, by indirect contact means what, right? They're not having the direct contact, not handshake, not like that. If someone is using that utensils or anything, right, or syringe, and the same thing is again used for the uninfected person, then it is spread. So that is indirect contact. And by food or mosquitoes or insect or rabid animals like dog, the animals which carry the microorganism. Okay, all these stuffs. Okay, so when it is spread by air, it is called airborne disease. When it is spread by water, it is called waterborne disease. And if it is transmitted through sexual contact, then it is sexually transmitted disease, STDs. And HIV, it is sexually transmitted disease. Okay, and this disease could be spread by blood transfusion. Okay, and also from infected mother to the baby, and from syringe also of infected person, and also from the tattoos syringe which is used, right, for tattooing the infected person, HIV positive patient. If it is used for the person who are not having HIV negative, then they will get infected. That is also a cause. Now we have this organ specific and organ tissue specific manifestation. Okay, so the organism, they are entering, if they are entering by air, they will infect nose, and after that it will infect the lungs. In tuberculosis, what will happen? It will affect the lungs. Okay, this is the way the bacteria will enter. It will enter through the nose, and they can also enter through the mouth, and they can go to other areas also, from mouth to the liver, or they can stay in there also, like in the typhoid. And they can also enter through the sexual contact, and they can also enter through mosquito bites. And now, depending on the target, the symptoms will be there. Okay, if the lungs are infected, then we will be having the cough, there will be breathlessness. And if it is infected, then jaundice will be occurring. For brain, we have headache, vomiting, all that stuff. Okay, now what are the effects of infectious diseases, right? Our immune system, right, it protects our body from infections. This immune system is the defense mechanism. And this if we are having strong immune system, what will happen? Our body will fight against the microorganism, the incoming pathogens, the foreign particles. Okay, and it will defeat. If our immune system is not strong, then we will suffer. Okay, it will be fatal. Whenever the infectious particle enter, right, our body, right, it will get activated, and it will respond to the infections. And what will happen here? We will be having many cells, right, wherever it is infected, right, then all the cells will focus on that area, and that will cause inflammation. Because of that, we will get swelling or pain. Sometimes what will happen, allergy will happen. Why? That foreign particles, right, will come, and our body will overreact to that particular what pathogens, particular particle, foreign substance. Because of that, uh, like pollen dust and all that, and because of that, the defense, right, it will be very high and very, what to tell, it will overreact. Okay. Because of that, allergy will happen. Okay. In some cases, right, our immune system will not be able to recognize the cause. Because of that, it will damage the function of our body. In HIV virus, it is that case. In HIV virus, what will happen? The helper virus, right? Helper cells which help, right, with that virus will come and kill that helper virus. Because of that, the immune system will be going down, will be down. Okay, this helper virus will help the plasma cells, okay, to produce the antibodies, okay, to fight the diseases. And so if the helper cells are infected, what will happen? The immune system will get affected. Even the minor infections, right, it will lead to death. Okay. And also the disease severity will depend on number of microorganism. Okay. Now, what are the principle of treatment? Two ways. First thing is, we can reduce the effect of the disease. What will happen here? In the AIDS side, there is not a particular treatment. Can I go to washroom? Yes, there is not treatment for that. So here, they are given medicine to make it patient more comfortable, right? To make it less painful. Hmm? And the most effective way of treatment is to kill the cause of the disease. That is the most effective way of treatment, right? If the cause is bacteria, then antibiotic will be given. If it is fungus, then antifungal medicine can be given. Okay. And if it is virus causing diseases, then antivirus drug could be given. Okay. So it will kill the microorganism. So disease, we can recover, full recovery will happen in this case. Now we'll talk about the first is what? Prevention is better than cure. That is the thing. Okay. So if we prevent the causing stuffs, then the disease will not occur. Here we have, see, what will happen is, we have many advancement, right? Here, like antibiotics and all the medicines we have. Sometimes, right, there will be some limitation. Because of that, what will happen? The person who are having, once they may be having disease, because of that, their body functions, right? Even though the disease is not there, but the body function, the body organs, right, it will be damaged, and it will not recover completely. And sometimes the treatment, it will be to particular period, right? They would be in bed only. So because of that, what is the thing? Prevention will be better than cure. Okay. Now, methods to prevent diseases. For airborne diseases, what will the method? What we can do is, we can make the place, any place, not overcrowded. So many people should not be there. Okay. So the disease will be less, spread less. Okay. Next, in waterborne disease, what is there? Here, what will happen is, the water, drinking water should be safe, and it should be treated before drinking. Okay. So that any microorganism are there, then it should be killed. Then vector borne, what is there? The in the breeding ground, water should not be kept in the open areas. Okay. So the mosquito, they cannot breed. And some other thing we can do is we could have a strong immune system. We could have balanced diet also. Next is vaccination. Vaccination. What is the vaccine? What is that? It is, see, we what will happen is our body, right? Whenever we have disease, right? When first time we are getting infected, right? Our body will take time to recover. If that same disease is affecting again, the same microorganism will affecting again, what will happen, it will have the memory of that organism, so it will directly fight off that, and it will end it. So in vaccine, what will happen here is the dead microbes, right? We will be getting injected with that. That is our vaccine. Okay. And because of that, we'll get the our immune system will recognize when the real microorganisms comes. That is the principle of this vaccine. Hmm. So there are a number of vaccines for diphtheria, pertussis, tetanus. We have DPT vaccine, okay, and poliomyelitis. We have OPV vaccine. Hepatitis B, we have hepatitis vaccine. Tuberculosis, we have BGC vaccine, okay, and children, right? They will be given vaccination vaccines, okay. Small babies will be given, right? Have you seen? So polio vaccine, our government has given for the polio vaccine. It started in res 1995. Okay. So this it aim was what, to eradicate this eradication of this polio. This is the aim. Under this, what will happen? All the children under 5 are given 2 drops of the oral polio vaccine. Okay. And this will happen in December and January every year until the polio is eradicated. Okay. So India, it has been declared polio free. That means no person is getting polio now because vaccine is given. Okay. So our this chapter is over. And you guys have 2 tests. Okay. One test was DLO, the other one is WFI. In Sunday, on Sunday we will have the DLO test. Okay. Shazan, Saturday, is it okay?
Yes, ma'am, it's okay.
Arham, okay, huh? Okay.
Yes, ma'am, it's fine.
Any doubt in this chapter?
No, ma'am.
Yeah, this chapter I think it won't come. Okay, but you have to know. Okay, next chapter will start natural resources. Thank you then. Bye bye. Take care.